having Dr. Zabah Muhammad Jawa from Muscat, Oman, who is a specialist in nuclear medicine. We will talk to him about dementia. Assalamu alaikum, sir. How are you?
Wa alaikum salam wa rahmatullah. It's a pleasure to be here.
Thank you so very much for your time, sir. We want to know what is dementia and how a person should deal and how he will understand that he is suffering from dementia right now. He should consult a doctor.
Well, dementia has a broad spectrum of disease, but the
Okay.
most important aspect of dementia is that these patients over time loses their memory, loses their personality, and they are unable to look after themselves
Okay.
because of this personality change and loss in memory of recent and past events.
Okay.
Right.
What kind of loss of memory? Like everything they lost everything from their mind, or they this is selective memory, like they choose what to remember and they choose what to forget.
Unfortunately, it's not like that. The loss of memory will usually start gradually from just forgetting simple things like going to the shop, simple things like drawing some simple things, or remembering the people over that they have known recently or past. So this memory loss is initially starts as a simple things, like I said, and then gradually advances to a more difficult stage where the patient is unable to do simple tasks like going to the shop or remembering even their own family members
Due to
due to
forgetfulness.
forgetfulness.
Okay.
Yeah. So there are a variety of reasons and there are a variety of presentations and timing of the presentations.
Okay. So how can we avoid indulging and suffering from dementia?
Well, the thing is that the most important thing to do is that there are certain dementias that are reversible and there are certain causes that are unreversible. And like we can see from our discussions today, we have several disease processes that when they happen to an individual, once this disease are cured, the memory loss reverses.
Okay.
And things like thyroid disease, hormonal changes, and there are certain behaviors and certain socio-economic things that happens to us that also significantly causes this dementia, like use of drugs, for instance, use of toxic materials, for instance, drug abuse and IV drug users, and some kind of infections. So those are things that are associated with memory loss.
Okay.
And once those factors are treated, the good news is that these patients reverse.
And what is the age when normally dementia starts, and in which region mostly the people suffers with it?
Well, the age difference depends on the cause of the disease. The majority of what we call the Alzheimer's disease is the kind of dementia that is seen in elderly people, usually from the age of 60.
Okay.
But there are certain cases where, like I said, certain factors like drug, like infections, like toxins, that tends to give you Alzheimer's disease even at the early stage of the disease.
Acha.
So people can present with Alzheimer's at adult at puberty age, depending on the type of factors that they are exposed to.
Okay.
Right.
So I want to know, can young people suffer with dementia, and if they are not, then what is it? We are forgetting the dates, we are forgetting the names, we are forgetting the faces. What is that then if it is not dementia?
Well, there are certain things, like I said, like that overlap, because dementia is a syndrome. A syndrome means that it's a disease with different types of cause and different presentations. So there are different disease conditions that can give you dementia, and the most important thing is to identify it, and the most other important thing is to convince the patient and the caregivers of this patient to always seek medical advice, because dementia in young individuals, vast majority of it is reversible.
Okay.
And we have seen a lot of people who, especially drug using and drug abuse patients, those patients, their processes are reversible. So the idea of this presentation or this conference that we did today is to remind ourselves of this syndrome and other things that can cause dementia and those factors that can reduce even our chances of developing dementia. Our lifestyle, for instance, exercise, diet, family and social activities, all these factors are important. And unfortunately, these factors, we tend to forget them or we tend to distance ourselves with them nowadays. And there's also an association of dementia and loss of memory to certain things that we do to ourselves. For instance,
Okay.
the excessive use of cell phone, because excessive use of cell phone has distanced
So
us from
does it matter?
social. It does matter a lot.
Okay, okay.
And we are beginning to see people developing dementia just because they are literally glued to their phones, and therefore they lack that constant social activity and social life where they interact with people, and which significantly
So
reduces
does
your chance.
mind become habitual of forgetting things because we are habitual of watching reels, and mind shuffle the things, and in blink of eyes you forget the things you have just seen? Because if we see 100 reels a day, we hardly remember one or two. What's that, and why we are? What's the reason behind that? We are not capable to remember those reels, what we have seen and watched.
Well, if you look at the process, the natural way our brain is created and the way information are stored in our brain, there are certain ways that or things that you do to store information in your brain. Just like you store things in the computer, in the flash drive, in the hard disk, the brain is also similar.
Yeah.
So the brain has a place where it keeps information for a short time, and it has a place where it keeps the information for a long time use.
Yeah.
All right. So the idea is to master a technique and make your lifestyle in such a way that you will put all the important information in the long term.
Okay.
All right, and not keeping information in the short time memory. And
Okay.
some of these things you can do is constantly reading, interacting with people, exercises, avoiding smoke, losing weight. All right, all these are factors that helps you to move information from the recent information to a permanent more information, or keeping information as much as possible, and
Okay.
not forgetting things.
Okay.
Other techniques that you can use is repetition. If you
Repetition
repeat,
of what?
repetition of words, repetition of events,
Okay.
repetition of books or things
Just
that
to
you read,
memorize?
just to memorize it. And no wonder why our old Islamic teaching and our old Islamic maulans, when you are told to to memorize a verse of the Quran, you will be told to repeat it as
Repeat,
much as
yes,
possible,
yes,
because the
yes.
more you repeat it, the more it is stored in the permanent
Okay.
part of the brain.
Okay. Sir, which region of the globe is highly dealing with dementia, and which region is having the minimum cases of dementia?
Well, it is very difficult to say that. What we know that dementia is right now a global problem. All right. So it is difficult to say based on people's population and their genetics and their way of life. It is difficult to tell you which country has the highest or the lowest. But
Okay.
what we indeed know is that dementia is now a huge problem, and it's a burden to our government, and it's a significant cause of mortality and morbidity.
Okay.
Yeah.
Sir, in last, I just want to request you to advise our viewers what they should do, how they should spend life to avoid dementia, and how they should be dealing in their social life with their surrounding ones and with their relatives and blood ones.
This is very important. Unfortunately, this kind of lifestyle is what has been happening recently, that we distance ourselves from our relative.
Yeah.
It is very important that we have a social life. Family life is very important. Friends and social gathering and social activities are very important.
So means being lonely is not a very positive
Exactly. Being lonely, it's one of the biggest contributory factors of dementia. People who live alone, who do isolate themselves, is one of the bad signs. So it is always important to socialize. It is always important to have family time, to keep ties with your friendship, your kinsmate is very important. It's very important to modify your lifestyle, your diet, weight, exercise, avoiding cigarette smoking, avoiding alcohol and toxin, all right, and reading, and always trying to learn new things. One of the ways the brain develops is when you challenge the brain to learn new things. That will reduces your chance of dementia.
Thank you so very much, sir, for your precious time. So, this is me, Sadia Khalid, signing off with Dr. Zabah Muhammad Jawad from Muscat, Oman. Hope you have understood and you have learned many new things from our conversation. Signing off for today. Inshallah, we'll be watching you in next program. Till then, Allah Hafiz.